How does racial trauma manifest in the workplace? Racial trauma in the workplace refers to the psychological and physical effects that individuals, especially Black, Indigenous, and people of color, experience due to racial discrimination, bias, microaggressions, or systemic racism. This trauma can stem from direct experiences or witnessing racial mistreatment and can accumulate over time, significantly impacting mental health and daily functioning. Psychological symptoms of racial trauma can be profound. Individuals may feel emotional distress, including anger, helplessness, depression, anxiety, and irritability. These feelings can be intense and persistent, making it hard to concentrate and perform job duties. Some may experience intrusive thoughts about past racist incidents or feel hypervigilant, always on edge and anticipating further discrimination. Low self-esteem can also develop, leading individuals to self-censor or suppress their opinions to avoid conflict. Social withdrawal is another common response, where affected individuals isolate themselves from colleagues to protect against potential racial stressors. In severe cases, symptoms can resemble those of post-traumatic stress disorder, including flashbacks, emotional numbness, and avoidance of situations that reminded them of their trauma. Physical symptoms can also manifest as a result of racial trauma. Chronic stress may lead to fatigue and exhaustion that does not improve with rest. Some may experience headaches, chest pains, or heart palpitations, reflecting the body's response to ongoing anxiety. Insomnia and sleep disturbances are common as well, making it difficult to fall or stay asleep. Other stress-related conditions, such as high blood pressure or muscle pain, may also arise. Behaviorally, racial trauma can lead to mental burnout, where continuous exposure to racial stressors results in emotional exhaustion and decreased motivation. Distrust and paranoia may develop, causing individuals to be wary of coworkers or supervisors due to fears of discrimination. This emotional toll can strain both professional and personal relationships. The impact of racial trauma on workplace functioning can be significant. Symptoms like anxiety and depression can reduce productivity and increase absenteeism. The need to self-censor or withdraw can hinder communication and collaboration, contributing to a hostile work environment. For many BIPOC individuals, racial trauma is not an isolated incident but a chronic experience tied to systemic racism. This cumulative exposure means that workplace incidents can trigger or worsen existing trauma, complicating recovery. Understanding how racial trauma manifests in the workplace is vital for creating supportive environments. Recognizing signs of distress, providing access to mental health resources, and fostering inclusive policies can help. Encouraging open dialogue and cultural competency can mitigate the impact of racial trauma and promote healing. In summary, racial trauma manifests through a complex mix of psychological, physical, and behavioral symptoms that can profoundly affect individuals' mental health and professional lives. Awareness and supportive interventions are crucial for addressing these challenges.